Well, it's been an exciting weekend full of workshops and office hours that have been conducted by the Stanford team, Apple Health engineers, and Google Cloud engineers. And people from all around the world have joined us to build these exciting products. I can't tell you how excited we are at CardinalKit to continue this particular excitement. This was our inaugural build-a-thon, so we weren't quite sure what to expect, but everyone really came out in full force. And we are looking forward to what the future is about to bring. We're lucky to have Oliver Lamy, Ross Venuk, and the one and only Paul Yock, the godfather himself of Biodesign, the man who founded the Biodesign Center, join us to give a little bit of a historical context and talk about what to expect in the future. So let's start with Paul with a little bit of a history of Biodesign.
Hello, I'm Paul Yock, the founder and director of Stanford Biodesign. You know, since our start 20 years ago, we got one thing right pretty early, and that is to focus on the clinical need, the needs of people in driving innovation. What's changed for us, though, in the last 20 years is our fellows and students are increasingly pointing us toward digital solutions. This has become an exciting part of the program. And so we're especially happy to be having the resources of CardinalKit available for our young innovators as they develop new innovations in the health technology space.
As founders of CardinalKit, we at Biodesign have really felt the pain of what it takes to innovate and how hard it is to build digital health solutions in the academic system and beyond. There's so many stakeholders that you need to address and satisfy, whether it's privacy concerns, security concerns, there are technical issues, building the front end, back end, and I as a clinician, I'm not a developer, so that adds another layer of complexity and difficulty. So that's what Biodesign is really focused on education, and that's what started off the CS 342 course. The first time it was taught was last fall in 2019, and we focused on teaching basically a very basic framework, which has become CardinalKit. And so we're super excited to be able to spread that more widely within the campus community at Stanford, but also more globally. And this is now spreading beyond. And Ross Venuk, who's also the head of engineering at Biodesign, has been able to lever it as well. And Ross, you can explain how you've been able to leverage it.
Yeah, thanks, Oliver. Something that we're excited about at Biodesign, we started as a program that was much more focused on surgical tools, catheters, maybe implantable devices, things like that. And as the health technology ecosystem has evolved, we're also evolving, and we're really excited about the new developments in digital health, and particularly excited about the involvement of tech meeting healthcare. One of the challenges is in Biodesign, we focus on understanding the clinical need really deeply. And as you said, Oliver, oftentimes the people who are closest to the front lines don't have the technical expertise necessary to launch a project. And so a tool like CardinalKit is something that helps to bridge that gap and to enable diverse teams to collaborate and to move more quickly as they try to create new health technology innovations. This is something that we've seen over the last number of years in biodesign as our fellows and as the students in our courses get more excited about connected technologies, and they're trying to figure out how to make use of the cloud and how to use AI and other exciting avenues to accelerate the pace of medical technology innovation. And so this is, again, why I'm really excited about the work that the teams have done during this weekend and into the future. CardinalKit is the platform and the community that's building here, building tools for all of us to use as we try to innovate and to bring technologies to more diverse populations and to expand health technology as quickly as tech is growing.
Thanks, Ross. I just want to plus one on something that you had said about machine learning in particular. I think machine learning presents tremendous opportunities for enterprises to be able to derive new insights from their data, whether it's creating new customer experiences, improving business operations, or helping the workforce to be much more efficient. It also opens up the potential for businesses to be able to start deriving new value entirely from new sources. For example, unstructured text. I want to go back to something that Paul had said earlier. It's really focusing on the need statement. I know when I was a student going at Stanford, going through the biodesign program, we were really focused on identifying the need statement and really getting that just right. Oliver, I'd love to hear more from you about how important it is to get that piece of it.
Absolutely. There is so much excitement around meeting the patients where they are. And our smartphones and mobile devices have kind of really allowed us to connect patients where they are. And what's really fascinating in biodesign is any successful or most successful solutions need to have a very well-defined need in their DNA. And what's really fascinating about digital health is now when we did our initial need searching or need finding in the hospital, it was within the four walls of the hospital. And now digital health has let us kind of look outside of the hospital and meet the patients where they are. For either scenario, it is it is very, very important to really spend a lot of time to think about the need and to develop a need statement where you very clearly define the problem, the population, and the outcome you're trying to measure and change and affect. And that will really keep you focused and also help you kind of address all the stakeholders in the healthcare system, since it is so complex, to come up with the most successful concept.
One of the things building on that, Oliver, that's most exciting, I think, about the partnership here between Apple and CardinalKit and Google being able to bring together developers like we have at this Build-a-thon is the ability to reach out to patients directly, whether it's through wearables or surveys or other sorts of mobile technologies. And putting the different technologies together through CardinalKit allows young innovators, and old innovators alike, to actually reach out to those patients and get that data and get an understanding of what the patients really want, what they need, and what can benefit them from a health perspective in ways that we've never been able to before. And so that's something that, again, really just excited about the different developments of this platform and the many different users and developers who are here this weekend collaborating to help build those tools is something that's going to enable the future innovators to understand the patients better and to understand the needs better, so that when they do develop, they can iterate quickly and they can find something that by the time it gets to market, they know is going to have great value for the patients, for the physicians, and for the health system.
Well said. So let me ask the two of you this. What's the future of CardinalKit?
That's a great question. It's only been a year since our first class last year, and it's only the very beginning. We built some really exciting features already to simplify this, but we just want to keep adding more and more features. And Right now we're iOS only, but we do plan to support Android in the future. That's on our roadmap. So we just want to see the community grow and see digital health flourish and see patients' needs met, outside of the hospital. So, Ross?
Yeah, just to build on that, what I would say is that the future of CardinalKit, in my mind, is in the hands of the developers and the people who have come together here and are going to continue pushing CardinalKit forward. The power of digital technologies is in the ability for people to build on what other people have done and to push very rapidly in different directions. I think the most exciting things about CardinalKit are probably the things we don't even know yet. Oliver mentioned a few things that are important, and we are excited about the community that we're building here of people who are going to attack the existing wish list in terms of platform and in terms of near-term capabilities. And then the future for CardinalKit, again, is the future of where the innovators, clinical and technical, take it, being able to be more connected with patients and with the healthcare system in the future of digital health.
Great. Thank you, Oliver and Ross. Again, we want to just mention the fact that this was our inaugural Build-a-thon. We weren't quite sure what to expect when we set out to plan this event. But again, we are very, very excited about what the future is about to bring. So please do give us your feedback. Reach out. Tell us how we can be better. What are some of the features that you would love to see? And we look forward to hearing from you and the amazing progress that we know you're going to make from the tools that we've given you to kind of build this digital health ecosystem in the future. Thanks again.
Let me know if you can see my screen. Okay, fantastic. So thanks again for joining us. And I think something that you probably all learned is that healthcare is hard. And as Mike Hiddle in his slide showed you the cable car to kind of get you up the mountains a little bit. Hopefully we're able to get you to the summit this weekend. And we did see the projects come in. They're all really exciting. And bottom line is, it takes teamwork. There are multiple stakeholders to address, and I'm sure you encountered that in great detail as you went through your projects this weekend. I want to extend, great gratitude for the Google Cloud team and the Apple Health team for helping us with all their amazing talks and being available for office hours. That was a really nice, comprehensive overview of all the amazing tools that we're going to have available, or we have available to us, to really innovate in healthcare. And I really do believe that the greatest innovations moving forward will not happen necessarily in the electronic health record, but on top of the electronic health record. And it's through tools like these and CardinalKit, which tries to bring it all together, that these innovations will happen. So we had, just to recap, we had over 500 people register to the event. This is our first event. And we had over 300 members join the Discord server, which is exciting, and about 12 admissions in the end, ranging from, covering all the topics and areas. In terms of the awards, there will be one grand prize. We'll have a Best CardinalKit App Award. We'll have a Best CardinalKit Feature Contribution Award, Best COVID, actually multiple COVID projects that get $5,000 in Google Cloud credit, as well as some Google engineering support. And we'll also, for every participant that was here with us this weekend, you're going to get a digital certificate. And we're trying to figure out if this can be uploaded or used on LinkedIn or not. So I think I'm going to go ahead and just, I don't know if the shift team is around or on. I was going to give them the opportunity to announce the awards, but if not, I'll just go through this. So for the first, I'm just realizing now I didn't tee it up to build suspense. We're just going to go right into the category, and you're going to see the winner. So, oh yeah, for all contributors, this is the basically the certificate you'll get with your name, which you could definitely put on your CV. So now for the first award, the Best CardinalKit App award goes to TrialX. Their problem that they're trying to address was a more efficient way to find patients with cognitive impairment for clinical trials and research studies. And they basically did a very, very good job of implementing from the onboarding to the surveys to tracking, using CardinalKit, and it was a very good way to monitor longitudinally any sort of neurological changes. So kudos to Sophie Parsa, Elizabeth Feldman, Apollo Zhu, Lucas Wang, Xingyi Xiang, Then Pong Precha, and Damien Katug. So congratulations on that award. And something I didn't mention is that we'll be contacting you. We do from your applications, we have your email addresses, so we'll be contacting you. All right, for the best CardinalKit feature contribution, that goes to Budabat team. And basically, they came up with a clever way to measure or to chart and show or visualize the health metrics that were collected within CardinalKit. So that team is comprised of Michael Sturpka, Kevin Hartman, and Tyler Lasky. And thank you all of you for all the the CardinalKit team was very appreciative of all the contacts you had with them and all the issues that you tackled in addition to this one. All right, next we have the three teams were actually chosen for the best projects. There are two listed here. Veranos, so they did a great job of tracking symptoms longitudinally. That team consisted of Ashley Griffin, Vishnu Ravi, David Bacek, Elsie Ross, Moksh Nirvan, and Joseph Bay, as well as Simran Bhatia, and HomeDerm, which did a great job of, especially during these COVID times when it's hard for patients to make it to the clinic. Many patients with dermatological lesions that needed to be monitored would not be monitored. They just were told to stay or not to come in. So they developed a platform to not only collect images, but have those images then be reviewed by dermatologists remotely using a smartphone. And the team members here are Lenny Linos, Antonio Lacio Ventura, Esli Osman Liu, Chris Liu, Molly Liang, Marish Isar, Sarah Kianian, Peter Lee, and Lucy Zhang. And the third team, which is not listed, was TrialX. They also get a COVID award. And so this is important because they get the Google Cloud credits, which will be very helpful. Oh yeah, there's TrialX. I guess was listed later. So for the best unmet clinical need, that was BHF. That was a very well presented need area, and it was a better way to reduce hospital readmissions for heart failure and non-hospitalized patients with heart failure to improve outcomes, improve quality of life, and reduce costs. And this is not only horrible and difficult for patients, but health systems also are financially dinged whenever patients keep coming back. And it can be very easily managed remotely. So kudos to Steve DeRico, Gary Pintado, Shiraja Rajakrishnan, Francis Ning, Alejandro Pisano, and Dr. Paul Wang. And first place or grand prize goes to Derminder, and they did a very beautiful implementation of CareKit. And we're all impressed by it. And their need statement was a way to increase compliance of patients with chronic dermatitis, such as psoriasis, in order to reduce flare-ups and decrease dependency on medication. So congrats to Robin Sardal and Eti Sinha. We'll be reaching out to all the teams that won awards tonight, so you'll hear from us, and we'll have to send everything to you. So thank you and congratulations to everyone. Remember to keep checking into the CardinalKit.org website for updates. Please do sign up on the mailing list there as well to get updates. And many of these videos will be uploaded there, and you'll find links so you can watch them later. We had to do some editing, and that's why they're not going up immediately. And also, more importantly, the Shift team, thank you again to Shift for your tremendous support during this event, in the lead up, the organization, the execution. And they run amazing events, and there's a datathon called the Blueprint Datathon, which is happening in October on the 23rd through the 25th. And there's more information at the link you see there, blueprint.stanford.edu. And the Health Plus Plus Hackathon, which would normally happen during non-COVID times during this fall, was pushed to the spring of 2021, but it's definitely happening. It's also a tremendous event to participate in. And also for the Stanford students, there's the CS522, a seminar in AI and healthcare, and they have really some of the biggest names in AI join their class. So it's a really remarkable opportunity. So that brings us to a close. And I just want to say thank you to everyone, and please do not hesitate to reach out to myself or the team. We want to be here to support you, and if there are any areas you think we could have improved on, I believe you will be getting a survey from us to follow as well. So if you could fill out that survey, that would help us figure out where to improve. And that's it. So I'm going to hand it off to Amir, who can finish it off with our astronaut, the CardinalKit astronaut. Perfect.